Midsummer. A bystander who witnesses a sudden loss of consciousness of an elderly man calls for an ambulance.
Emergency? Please send an ambulance.
Who's calling? Can I have your name?
Oh, Monica Bednarek. I'm a medical student. An elderly man has just fallen over here at the bus stop, and he's not responding to me.
Okay. What's your exact location?
The city center, the bus stop at the junction of Maria and Halera Street.
What's the telephone number you are calling from?
It's my mobile, 508-491-233.
Tell me exactly what's happened.
I was waiting for the bus and just noticed that the man suddenly lost his balance and collapsed onto the pavement. No one was accompanying him, so I tried to offer some assistance, but he was unresponsive. So now I'm calling emergency services.
Is the patient breathing normally?
Yes, he seems to be breathing regularly.
Is the patient conscious?
I don't think he is. Sir, can you hear me? No reaction.
Can you see signs of any bleeding?
No, I don't see any injuries.
How old is the man?
I'm not sure. Approximately 70 to 75 years old? Can I do anything before you come?
An ambulance is on its way. Can you stay with him until they arrive? I need you to follow my instructions.
Just tell me what to do.
If the patient is unconscious, but is breathing and has no other life-threatening conditions, he should be placed in the recovery position.
Okay, I know how to proceed.
We need to keep the patient's airway clear and open, and to make sure that any vomit or fluid won't cause him to choke. Are you by him right now?
I am.
If he is wearing glasses, remove them now.
Okay.
Kneel on one side of the patient and straighten his legs. Position his upper arm nearest to you in a 90-degree bend in the shoulder and elbow joints. When the elbow is bent, the hand should be placed upwards.
Yes.
Place his other arm across his chest and position the back of his hand under the patient's cheek.
Right.
Now grab his other leg, slightly higher than the knee, and pull it upwards, without lifting the foot off the ground. And pull the lower leg so that he is turned on his side, facing towards you. Do you follow me?
Sure.
After turning the patient, place the upper leg in such a way that the bend at the hip and the knee is 90 degrees. Gently tilt his head backwards to make sure his windpipe is not blocked.
Right. I remember that the respirations of the injured person should be constantly monitored.
Correct. And finally, adjust his hand under his ear to keep the head tilted and facing downwards. This will allow any liquid to possibly drain from his mouth.
Done. It is too hot to cover him with a blanket or a jumper.
Good job. Now, please stay with the patient and monitor his condition until help arrives. You can call me if his condition worsens.
Okay, thank you.